All right. Now I would like to introduce Tasha Lee. She is the Director for Policy and Alliance Development for the Heme Program from Vertex Pharmaceuticals, and she will lead our next panel discussion. Thank you, Tasha, for being here.
Thank you so much, Mariah. I am so grateful to be here today. As she shared, I am from Vertex Pharmaceuticals, where I lead our patient advocacy program for sickle cell disease as well as beta thalassemia. I want to thank Sickle for hosting this, and I want to thank each of you for participating in this policy forum, because it is the voice of the patient or the individual living with the disease and those of their caregivers that are the most important discussions and should be at the table for policy discussions around challenges and barriers, as well as gaps experienced by the community. This session will discuss the community impact of the HRSA demonstration program. As Mandy just shared, the Health Resources and Service Administration, or HRSA, has sickle cell disease programs focused on strengthening the system of care by educating patients and families, as well as providers, helping families get the best care and fostering partnerships. On her last slide, she really shared about those regions. So HRSA has those 5 regions, and in one of their programs, it's really led by community-based organizations. So joining us for the discussion this afternoon is Rosemary Britts, who is the Executive Director of the Sickle Cell Association in St. Louis, a nonprofit that she founded in November of 2011. That was prompted by a lack of community-based organization for sickle cell disease in the state of Missouri, and the fact that her oldest child, Ro, was living with sickle cell disease. Following Rosemary's presentation, we'll hear from Annie J. Ross-Womack, who serves as the Executive Director for SCDAA Ohio Sickle Cell and Health Association Incorporated, a statewide nonprofit providing education, advocacy, and support to individuals and families affected by sickle cell disease for over 60 years. I'm going to turn it over to Rosemary.
Thank you so much, Tasha. So as she stated, I'm Rosemary Britts, the Executive Director of the Sickle Cell Association, and we're in the Heartland region. And do we have the slides? So we titled our grant Cultivating Sickle Cell Champions Initiative. And next slide. The Sickle Cell Association has a mission to support the sickle cell community while working to eliminate the disease through collaboration on research, education, and resources. I feel that collaboration is very important in getting anything done, and you can't really do things in a silo by yourself. You actually have to connect with others in order to make it happen, or at least it makes it easier when you connect with other people and not try to do it yourself. Next slide. So we serve the entire state of Missouri, and in Missouri we have about 2,000 individuals that are living with sickle cell disease, and we know that there are about 1,200 that are registered across the state as patients in the sickle cell clinics throughout Missouri. The greatest portion of the individuals with sickle cell disease are concentrated in the St. Louis area, which is where our organization is actually located. And the next largest population is in Kansas City area. And we connect with an organization there, the Euro Owens organization, in order to help support the individuals in the Kansas City area, but we help throughout the state of Missouri. Next slide. So some of the things that we do with our organization is hold monthly support group meetings. We have been doing, since COVID, we've been doing those virtually, and we're just moving back into kind of a hybrid. Some people are wanting to go back in person and others are wanting to stay virtual. So we make it available for everyone to be able to meet their needs. We have different topics that we have in the support group where we sometimes bring in speakers for specialized topics. Other times we just have open conversations to allow the participants to discuss things that are going on with them and get support from other individuals that know what it is that they're going through. Those support groups are pretty well attended each month, and people really look forward to those. We also provide financial support. It is limited financial support, but we're able to help with utility bills and some deposits when people are trying to move in or finding themselves in a homeless situation. We also help with transportation to get to appointments and other events. Our community health workers help individuals with referrals to assist them with their daily needs. And then in our office, we keep resources such as new clothing, coats, shoes, household products that our participants can come in and just help themselves to as they need those. And we'll go out and get other things as they request that we may actually not have in the office, but it's something that ends up being helpful when you can come in and get toilet paper, paper towels to help to extend your monthly budget. And then we do patient advocacy in the schools and with the medical system in order to help people to get across the message of I'm living with sickle cell disease, and this is what I need in order to live my best life possible. Next slide. So we've had to try to overcome various challenges in our area in terms of sickle cell. And we do that with community engagement. So we've been working with banks and some of the, like the Divine Nine fraternities and sororities and different businesses in order to help with that collaboration process. And so that helps to get more awareness and information in the community. And we can also utilize the resources of some of those agencies or organizations that we don't have, but they have, and we can extend it to our population in order to assist them. There have been issues with care amongst the various hospitals, as some of you may have in your area. And what we wanted to do is to have listening sessions at one of the main hospital one of the main hospitals in our area that the sickle cell population goes to. And that was important to me because when I'm presenting to the hospital, hey, these are the complaints that are coming in about what's going on in your ER or in the clinic, the physicians or the powers that be may often feel that it's something that I've made up or I'm just bringing to them arbitrarily. But I felt that having a listening session with the hospital and the patient population, then the hospital can hear this from the patients firsthand. And I was having trouble in getting those listening sessions scheduled, but we were finally able to get them scheduled. The hospital was able to hear, the physicians came and some of the administrators, and they were able to hear directly from the patient population as to what the issues were, what the concerns were. And they realized that it wasn't something that I was just making up. These things were really happening. They were getting direct examples. And so as a result, the hospital came back to us what they thought they heard and how they could try to fix it. And so I'm happy to report that they have created some physician and nurse education across the hospital system for sickle cell and the care of individuals with sickle cell. But as of April 2nd, they are actually opening a dedicated infusion center for sickle cell. And so previously, we had to share a space with oncology. And unfortunately, what would happen is they would say, oh, all of the chairs are taken up. We can't get you in. You got to go to the hospital. And so as you may know, going into an infusion center and getting a treatment could help you to avoid having to go to the hospital. So I get to be at the grand opening of this center. They have inquired about my thoughts on what I wanted done. I told them I wanted Hertz Nazir's paintings on the wall, and I got to pick the caterer that they're going to use to provide some food and snacks for that day. And so I'm super excited about seeing this center open and any expansion. So that's something that's really exciting for that. In fulfilling our grant objectives, we have been working to pursue MOUs and BAAs with the various hospitals and clinics so that we can connect with the patient population that is already established, and then therefore we can use our other time in working on connecting with those that have been lost to care. And so I didn't feel like we needed to spin our wheels on connecting with the patients that are established in the hospital if the hospital would work with us in order to connect with them. If they're already registered there, then the community health workers could just focus on making sure that those individuals have a medical home. That has been quite a challenge, as they like to say HIPAA. They can't do this and that because of HIPAA, but we were able to create a BAA with one of the hospitals in Kansas City, and that is going well. And I'm hoping that that will be an example for the other hospitals, and we can continue moving forward there. Next slide, please. So where we're going from here, we have 3 community health workers and a sickle cell educator. So we're trying to continue to utilize them in connecting with our patient population. We're working to grow the Sickle Cell Association with more volunteers and grow our board of directors in order to help us to further our mission. We've been expanding our programs. We did do a caregiver retreat. We've had that for 2 years. And this year we're working on combining, having a combined caregiver and adult warrior retreat. And so really looking forward to seeing what that looks like. The caregivers have been super excited about the caregiver retreat. And I think that it'll be a plus to add on an adult retreat. And then just mental health is important all around. And it's been a real struggle, but working to open up some doors in terms of mental health for our population. For the legislation in Missouri, we have we were able to get a bill passed last year that requires them to do an annual Medicaid review of the treatments for individuals with sickle cell and their needs. And so looking forward to seeing how that actually plays out in increasing resources for the sickle cell population in Missouri. And then they also made the 3rd full week of September Sickle Cell Awareness Week for Missouri. And so we put a lot of activities, extra activities, we already have the month, but extra activities in that week for the legislators to participate in, to tweet out or, share with the residents of the state of Missouri. Next slide, please. And so we have a couple of signature events that we do along with all of our programming. So the Sickle Cell Stroll and 5K is our annual awareness walk. And it brings out a pretty good amount of the community, sickle cell warriors, their families and friends, and then just the community in general. We've been getting more organizations and businesses to also come out and participate in our sickle cell stroll. Next slide, please. And then we also do the Committed to the Cause Gala. And thank you, Annie. She was our MC of our gala this last year. And so it is an event that we utilize as a fundraiser, but we also are able to provide awards or acknowledge those who have been committed to the cause of sickle cell and helping to further our organization. Next slide. And so I want to thank you all so much. I'm Rosemary Britts, again, of Sickle Cell Association in St. Louis, Missouri, the Heartland region, and this is our contact information. Would you like for me to ask questions, answer questions now, or go on to?
I think we'll take questions at the end in case they're both questions for you as well as Annie. Thank you so much, Rosemary, in providing an overview of the organization and the work that you're doing in the Heartland. I'm going to pass it over to Annie now.
Greetings. Thank you, Rosemary, for inviting me to be your gala host. It was exciting. I bring you greetings from the Midwest region, which is composed of 8 states, 4 of which are funded. So we work very well with our partners across the mighty, mighty Midwest. We are excited to have this partnership and be a part of the HRSA Newborn Screening Project. So a little bit about OSHA. So all the great things that Rosemary did and what she does and what a lot of our CBOs do, we all do that. And so how do we do that? So my presentation is more on how we sustain ourselves with lifelong partners. So next slide. So the Ohio Sickle Cell and Health Association was founded and organized in 1960, founded in 1977, and incorporated as the Sickle Cell Disease Association of America, Ohio Sickle Cell and Health Association, we say OSHA for short, and it was established from the need to provide a funding mechanism for adults and adults living with sickle cell disease and who were medically injured, with the focus and the intent to help solve this sickle cell disease in the context of a broader social and issues facing Ohio's children, minorities, and poor. So our mission, again, as was stated lovely by Ms. Tasha, is to provide education, advocacy, and support to persons and families affected or at risk for sickle cell disease through effective approaches to sickle cell services. We are a 501c3 organization. We are also provided services for all 88 counties of the great state of Ohio. So our purpose and objectives started the great groundbreaking New York congressperson or congresswoman in Women's Appreciation Month, Shirley Chisholm, told us back in 1970 that if they don't give you a seat at the table, bring a folding chair. So we try to bring a folding chair, roll-out chairs, extra chairs, benches to every table that we find ourselves. And so our objective is to have a stake and be concerned about health problems that relate to all the underserved populations of Ohio. We serve as a coordinating body for sickle cell trait disease and other hemoglobin blood disorders all across our state. We serve as a resource base for programs with all health organizations in all 88 counties. We develop support for individuals and families affected by sickle cell disease, and we inform and educate professionals and lay communities about the sickle cell phenomenon. One thing that we do provide is how we're supported. We're supported through various grants, funding mechanisms, and donations. We have 3 large funders. Of course, we are the Ohio chapter of the Sickle Cell Disease Association of America, but we are also funded through our state. We're one of a handful of CBOs across this nation who are actually a line item in our state's budget. So we are funded through the newborn screening kits. And from those kits, we receive a designated amount for every child that is born in the great state of Ohio. So we have been receiving that funding since its inception, and we were first funded under Dwight D. Eisenhower. So that's how long we've been funded. So we have, for several decades, we have walked alongside the Sickle Cell Disease of America, which was founded as the National Organization for Sickle Cell Disease. And so we predate the SCD office, and not that many of us can say that. We have been involved in every part of government legislation, healthcare objectives since the beginning of the national office, and then now until today. So we provide a vast array of community services. We provide lifespan services. So from a person's born, they get their screening up until they leave this earth. We provide services for our families and individuals who are living with sickle cell disease. We provide community resources, patient resources, some of which Rosemary has already talked about, professional health education, public health education. We provide resource information, and we support the global organizations and partners, not just our own in the Midwest, but we think, of course, sickle cell is a global pandemic. So we support our global initiatives that are supported through SCDAA and some of our global partners, which are probably in this call. Again, we are the Ohio chapter of the Sickle Cell Disease Association of America. We provide community-based organization training and development to all of our partnering organizations under SCDAA, those who are members and those who are not. We have been very instrumental in the community health worker training. We do employ several community health workers, and we have been part of a HRSA demonstration project grant for about 3 iterations now. We provide consumer legislative advocacy on issues relating to sickle cell disease in our state. We provide, as Rosemary has stated, consumer emergency support services for individuals and families, whether that's cash support, whether that's physical support, or financial support, or pay bills, or unfortunately pay for services and funeral services. We provide consumer empowerment around clinical trials and pharmaceutical research and development. We provide consumer medication adherence assistance. We are part of the SCD data collection database that they started back when Get Connected. And we are coordinate adults, including young adult transition services. And we also provide national social media campaigns for individuals and families with sickle cell disease. So how do we do that? If you look at that slide, those are very predated old. This young woman will appear several times in this presentation, once on the cover, that lovely young woman, and then also she's the second woman from the side with the formation of the Black Nurses Association, which was formed with a group of folks from Ohio, Texas, and then I think Detroit, Michigan. Next slide. So how do CBOs stay afloat? How do CBOs work? How do CBOs stay relevant? And it's with partners. So I wanted to just give you some partnership and some key takeaways. So OSHA is one of the longest standing partnerships, has been with our Black Nurses Association. The lovely woman you saw in her nurse's uniform in the 40s is this young woman here. Her name is Gwendolyn Macon Beck. She serves as the longest serving employee from Ohio Sickle Cell. She's still employed today, and she is celebrating her 90th birthday. She started as our first outreach nurse when we first were funded. She started as the first executive director. Now I serve in her stead. And she also provides service continuity. So when these children that are now entering into their golden years have known her their whole life. So she is a living example of how to provide service continuity. And she reminds us that service to this population takes a lifetime of care and compassion, because she has truly lived a lifetime and she has served sickle cell for many, many years, beginning in the 60s. So I want to leave you with 3 key takeaways. Never forget those who helped you when you had no money. A lot of our CBOs started with nothing. They were family startups. We were, the old sold dinners, did whatever you had to do, have fundraisers to stay afloat before there were grants, before there was HIPAA, before there were grant programs in a lot of our states. We took care of our own by any means necessary. Takeaway number 2, true partnership allows both groups to flourish. As I've stated, Ms. Gwendolyn Macon Beck also started the first sorority chapter of Black nurses. So they started in a back room, and now they have a national organization. So they have flourished, we have flourished, and all of our organizations across the state utilize the Black nurses, and we recognize their voice as being a strong voice for our individuals living with sickle cell in every hospital and in any healthcare setting. And then my last takeaway is that partners with the same goals lead to greater service outcomes. We must align ourselves with individuals institutions, organizations, whether it's pharma or whether it's just any grassroots organization, church, community, ecumenical, as Rosemary stated, fraternities and sororities, that all have the same mission to serve our individuals in our sickle cell population. And once we all align ourselves so that at the end goal, it's about the individuals and families living with sickle cell disease, stripping away egos, stripping away who's at the top of the table. But I would also like to leave you with 2 quotes. I started with Shirley Chisholm telling you to bring your folding chair to the table. Elizabeth Warren said, if you're not sitting at the table, you're probably on the menu, meaning that if you're not at the table making the decisions, somebody's making decisions and talking about you, but they're not servicing us. And President Barack Obama said, nowadays, it's not enough just to sit at the table. We must assume the helm or sit at the head of those tables. So I encourage all of our CBOs, families that are listening today, that our challenge is clear and our goal must be set, that we must be the voice of the sickle cell community. Thank you.
Those are some powerful words, Annie. Thank you for those. We are now going to move into the panel discussion. And so there are a number of questions that have come in. For those of you online, please feel free to use the Q&A feature on Zoom to enter your questions. I am going to actually start with a question around deserts. So there was a question, let me see if I can find it, around healthcare deserts and how do you serve individuals and ensure that they have access to treatment in areas of deserts, and what of treatment deserts, and how would the community-based organization potentially fill those roles and connect them?
So for us here in Missouri, we do have individuals that live further out. What our organization does in that situation is to provide transportation services for them to get to a local area. We do have one of the hospitals that has been going out and doing outreach services for individuals with sickle cell in rural areas. So they'll actually go into those locations. But as far as our organization goes, what we do is provide support through transportation to the nearest area for them to get treatment.
Thank you, Rosemary. Annie?
One of the things that we've done, and Rosemary, she talked about it in her presentation, we have started back in 65 support groups in every area of our state that has a hospital. So we have support groups in some of our 88 counties. You know, there aren't a lot of folk that live with sickle cell disease or trait. But what we have to understand is that it's just not our population, meaning the Black population. So we make sure that we include all of the ethnicities that are informed. So in some of our populations, we have a large Hispanic population. So we use the boots that are on the ground. We partner with the Hispanic nurses population. We partner with any partner that has the same mission as I stated. So you go into these areas that look, if they don't have a hospital, and you know, as Rosemary stated, there may be transportation, provide transportation, but we partner with a person in that area that can also help provide service, and we will just come alongside to assist them. So if there is need for transportation, we can have transportation dollars. If there's need for people to help pay for prescriptions, so we can cut a deal with, I won't say cut a deal, but we can talk to maybe a large pharmacy and we can get pharmacy card, and then those can be distributed because we are statewide and we do have a statewide footprint. They'll give us the cards and then we can disseminate those to folk in those desert areas. And we also work with our Food and Drug Administration. We work with every level of our government to see what services that if they have these services, we can come alongside to make sure that our sickle cell population and our families are benefiting.
This next question was a difficult one, so I actually had to Google it in case either of you didn't know, but Annie, you may know the answer to this one. So the question was, Joint Commission awards disease certificates in various diseases to health systems. Are there any hospital systems that currently receive an SCD certificate? If so, what is that hospital and where is it located?
We have one in Ohio.
Yep.
It is the Ohio State University, and I think it's the only one that holds that certificate. And that was given under Dr. Cross and Dr. Desai when they were there in the comprehensive sickle cell adult clinic. And so we have a day clinic, and then we also have a clinic in both of their regions, one on the east side and one downtown in the James Cancer Center. But then we have a standalone day clinic where our individuals can go and bypass the ER altogether. And so we are the ones that hold that certification in the great state of Ohio.
Thank you for that. I actually learned something today because I was unaware that there was one. And so for those of you not familiar, the Joint Commission has a disease-specific certificate program. They started these back in the early 2000s that evaluates clinical programs across the continuum for compliance with the Joint Commission requirements. Organizations that seek certification are examined during an on-site survey, and the reviewers assess how those clinical outcomes and performance measures are used to identify opportunities for improving care and ensure that the organization is committed to improving quality of care. They also assess how patients and caregivers are educated and prepared for discharge, and whether evidence-based guidelines for clinical care is incorporated into daily practice. That is amazing, and congratulations to Ohio.
And then I also wanted to say, if you go to that site, sickle cell has been removed from the list. I don't know why, but we need to definitely fight to get that back on, as other hospitals are seeking that certification. So we need to, I mean, if you go down the list, it was on the list. There's applications for a lot of disease states, but there's last year, a year and a half, because one of the CBOs contacted me and asked me how they go about it, and they said, we don't see that sickle cell on the list anymore.
Yeah, I only saw hematology when I looked.
Hematology, because that was the move of somebody's administration in DC of the single disease legislations and things like that. So they lumped it all together under HEMA.
All righty, are there any other questions in the Q&A? Let's take a look. So we answered Auntie Renee, we answered Maureen. There's a question, can we advocate to remove the language of severe sickle cell anemia and using one factor such as hospitalizations for severe pain crisis in all legislation? The focus is keeping sickle cell patients out of the hospital. There are so many indications for hospitalizations associated with sickle cell other than pain crises due to the pathophysiology of sickle cell disease. Many other diagnoses are used for sickle cell patients related to their infections. So it wasn't a question, but a definite statement. I will definitely put the link as well for the information on the Joint Commission. Are there any other questions coming in from the Sickle Cells team? Do you see anything that I'm missing? Good question. So Ashley Valentine asked, how has the HRSA program impacted your work?
Rosemary.
Let's start with you, Rosemary.
Mm-hmm. So for us, it actually helped with the needed funding to, one, get the community health workers to help extend the work, to do the work. Prior to that, it was all me and what I could do. And so this has allowed us to bring on individuals as hands and feet to get into the community and do more. I wear a lot of hats, but that's, this has helped to truly be able to touch more of the individuals living with sickle cell and bring greater awareness into our community.
Well, for us, I think it allowed us to keep and retain our community health workers. So we started hiring community health workers under, again, the grant that SCD had, and we were co-recipients. And then we had to apply for ourselves. And I think what it did was open up, it did two things. What it did was educated some of our newer community CBOs on how to be a part of a grant writing process. So it allowed that opportunity for people who normally would not be funded by HRSA, HSS, or any other government funding mechanisms to have a specialized funding mechanism. So thank you very much, HRSA, for allowing it just to be sickle cell specific and then to be specific to community-based organizations so that we did not have to compete with the dollars with larger institutions who could probably grant write us to get those. So that was a great opportunity. And then it put more community-based organizations at that table to get a slice of that pie, where traditionally, as Rosemary stated, they wouldn't be able to get those type of funding, those type of funds. And then what it also did was allowed us to be able to hire individuals. And I don't know, because with our CBOs, a lot of our CBOs, I can tell you that, well, majority of my staff, 80% of my staff, either are individuals living with sickle cell disease who could not work in mainstream employment because of the severity of their disease. So this grant also helped with part-time work, contract work for those individuals, and then family members and caregivers of individuals with sickle cell who probably would not be able to work in mainstream because they would have to take off long hours. So this grant enabled us to kind of hire experts that are living with and do the caregiving, so that when they go out and talk to people, they're saying the same thing, they understand, and they can truly relate to who they're serving. So which makes it an extra benefit, and we appreciate those members. Keep them coming.
There was a question also in the chat, it wasn't in the Q&A, around the newborn screening kits and then how those kind of get to your organization for follow-up with those families. Can either of you answer that question?
Annie, did you speak on that? I didn't have.
So what we did here again is another partnership. When we started back in the 60s, you know, there were different screenings, there were newborn screenings, and then we advanced. Our state was not doing newborn screening. So actually Miss Macon Beck and 4 other women actually partnered with the Black Panthers, and they did door-to-door screening, and they had their own lab, they did their own apheresis, they did the swabs, they helped with the Head Start project. So we have that traditional boots grassroots on the ground. So now how it's done is we have, through the funding mechanism we partner with every children's hospital in the state of Ohio. So we have 6 regions. So we have hospitals, and what happens is our lab, they run it. If there's a ding for a sickle cell trait, sickle cell disease, or something abnormal in the hematology, they send that to those regional hospitals, and they all have so many states, so many counties within their designation. They would get those results. They would make first contact to inform that family that you have an abnormal reading, bring your child back to the hospital, take your child to the hospital to get tested, to get that confirmation that it's trait, disease, or what variant that the child may have. It may just not be, maybe an abnormal reading. And so that has been going on since the 80s here. And so that's how we get those, and what we do, we partner with the hospitals. And sometimes, you know, we can't find people. Sometimes people move into the state, and that's where our agency kicks in, because we work with all of our bordering states. I think it's 7 that border Ohio. We work with all of those folks, because we have people that move in that were not tested here. Then they go to the hospital. The only information they have is that they may have something they don't know, and we send them out to get a new test. And then that's how we stay in contact. So initially it goes through our hospitals. It used to go through our labs. We used to have satellite clinics all over, because we serviced our own folk. And so now it goes from the state lab to those regional partners. Those regional partners make the first contact. And then if they can't find them, then we have other agencies that kick in to try to assist in finding those families.
So this has been so informative. We have 2 minutes left, and I see at least 2 or 3 questions. So I'm going to put the response to one of the questions about who are some of the sickle cell disease program partners across the region in the chat, so you can see it from HRSA's website. But there's another question. Do you have any interaction with the prison system and incarcerated individuals? If so, what is your process?
So I don't currently have any type of a program for the prison system. It has come up a few times, excuse me. But we have not created a program or a process for that at this time.
Our state has a program because we have a women's prison. And so we used to have a hospital, a prison hospital. All the pregnant women were there that were incarcerated across the state of Ohio. They go to one place, and then we would go in, talk to them about the newborn screening process. We talked to them about the test that their children would take, the heel stick. We explain all of that. And then we would work with some of the social services organizations to see if they are going to keep the child, or who's going to have the child when they, since they have to finish out their sentence. And so now what has happened is that program, under our great leadership here in the prison system, because the woman who runs the prison system has family who's incarcerated, so she understands the system. And so now everyone is in one place. It's out in Marysville, Ohio. So all the women are there. And so their medical director is part of some of the nationwide children's hospital family. So what happens is we go out, we do education, we get the nationwide will get the results to let the families know. So then we go out and we partner with them on all type of education. What are they going to do? Are they going to adopt the child out, or they can keep it? But then they also have a new program that was instituted with a lot of nudging and a lot of support, that the women can keep their children there if they're low-level offenders up until a certain time to get that bonding, and then their families can come in and get the child. And so that way we know if a result is imminent, we will know where the child lives. Because in the past we didn't know, because the mom didn't live at the prison. She just had to do a sentence, but where was the child? So we do work heavily with on the male side and the female side. So we do also do male programming for young men who are in the system, and then go in and assist them. That's what my men do on that side. We do exactly.
Thank you, Annie. I want to thank both you and Rosemary for all the work that your organizations do, your advocacy, your support for the sickle cell community. And I'm going to pass things back over to Mariah. I know there's a lot of applause for the work you do also in the chat, so hope you're reading those. Back to you, Mariah.